Good afternoon, guys. I've got C for you. We're discussing non-pharmacological approaches for Parkinson's care. Okay, so that is C for this afternoon for you. Okay, non-pharmacological approaches in Parkinson's care. There's growing momentum in using non-pharmacological treatments to support people with Parkinson's disease. These approaches emphasize holistic care, including both physical and mental health strategies, patient involvement, and um, patient involvement, participatory research. Patients are increasingly included in designing treatment programs, shaping consensus on multidisciplinary care, and identifying meaningful outcome measures. This shift fosters a more inclusive and personalized healthcare experience for those folks. Research and clinical practice. Studies show that many clinicians are recognizing the limits of traditional uh, pharmacotherapy. There's rising evidence that well designed non pharmacological interventions can complement medical treatment and enrich care, access, and equality. A focus on improving access to these interventions supports more equitable model of care, especially relevant as Parkinson's cases are projected to double by 2050, folks. Oh, and the people with Parkinson's, they're in society, folks. They're integrated into society. So, it's a well given fact that people with Parkinson's deserve to be treated like normal folks, like normal human beings, also with attendant care and such. Okay, so just wanted to throw that out for everybody's FYI. Okay, focus on improving access to those interventions supports a more equitable model of care, especially relevant as Parkinson's cases are projected to double by 2050. If you'd like, we could dig into the types of interventions covered or explore implications for memory friendly and frailty aware care. Curious where you want to go next? Absolutely. This is a rich area of innovation in Parkinson's care, And it's exciting to see how it aligns with your interests in holistic, equitable models. Here's a breakdown of some of the most effective uh, non pharmacological interventions being explored and implemented. Okay, physical activity and exercise. Tailored programs like high intensity treadmill training, Tai Chi, and dance therapy improve gait, balance, and motor coordination. Cueing strategies. Rhythmic auditory cues help manage freezing of gait and enhance mobility. Speech and swallowing therapy. High intensity voice treatments like LSVT, loud, and video assisted swallowing therapy support communication and reduce uh, aspiration risk. Cognitive and uh, psychological therapies, cognitive behavior therapy or CBT, including mindfulness based approaches, shows strong effects in reducing anxiety, depression, and impulse control disorders. Cognitive training and third wave therapies, e.g., ACT, are are prioritized for assisting mild cognitive impairment and stress. Okay, arts based interventions, dance, music, and visual art therapies foster emotional expression and social engagement and motor function improvements. Light therapy and stress reduction. Light therapy and mindfulness practices help alleviate stress, which may influence disease progression and symptom severity. Okay. Support and education. Peer support groups and caregiver education enhance emotional resilience and care coordination. Digital and remote interventions. Telehealth, CBT, virtual exercise program, and wearable cueing devices expand access to expand access, personalized care. These interventions are increasingly integrated into multidisciplinary care models with growing emphasis on participatory design and outcome measures that reflect patient priorities. If you'd like, we can explore how these approaches intersect with memory friendly housing, frailty aware care, or even predictive behavioral algorithms. What direction feels most compelling to you? Let's take a closer look at dance therapy, which has gained impressive traction as a non-pharmacological intervention in Parkinson's care. It's a great example of an interdisciplinary approach that taps into physical and cognitive, emotional, emotional and social domains simultaneously. Okay, dance isn't just about movement. It's about rhythmic, emotional, expressive, and cognitive, cognitively demanding. Here's how it serves people with Parkinson's. Motor function enhancement. Dance incorporates rhythmic cueing, which helps overcome gait disturbances and freezing episodes. It improves postural control, balance, and range of motion, supporting neuroplasticity and coordination. Cognitive engagement, learning choreography, learning choreography uh, stimulates memory and executive functioning. Repetitive patterns strengthen postural memory, valuable as Parkinson's often compromises episodic recall first. Emotional psychological benefits. Music and movement reduce anxiety and depression. Participating in group sessions fosters a sense of belonging and enhances motivation to continue therapy. Accessibility and adaptability. Styles like Argentine tango, ballroom, and the creative movement are commonly used because they can be tailored to various ability levels. Dance classes are increasingly delivered via telehealth platforms, expanding access to rural and underserved communities. Evidence snapshots. Studies in journals like Neural Rehabilitation and Neural Repair and Frontiers psychologically show significant gains in motor control, mood, and quality of life. Many programs now incorporate dance into multidisciplinary care, recognizing its dual therapeutic and social value. Would you like to compare this with something like Tai Chi or telehealth based cognitive therapy? There's a fascinating intersection between expressive therapies and memory friendly interventions. That's right in your wheelhouse. Absolutely. Telehealth based cognitive therapy is fascinating, is a fascinating, increasingly viral approach, especially for Parkinson's care. Let's unpack it in depth. What it is. Telehealth based cognitive therapy typically refers to cognitive behavioral therapy delivered remotely via phone or video platforms. It's designed to treat depression, anxiety, and apathy and other non motor symptoms in Parkinson's disease or PD, which are often underdiagnosed and untreated. Why it matters. Accessibility. It removes barriers like transportation, mobility, limitations, and geographic isolation. Community of care, especially during disruptions like the COVID-19 pandemic, it ensures ongoing mental health support. Patient preferences. Many individuals with PD prefer nonpharmacological options due to side effects or polypharmacy concerns. Core components of telehealth CBT, mood monitoring, and thought restructuring. Patients learn to identify negative thought patterns and reframe them. Okay, guys, I've got a couple of examples for you of CBT therapy. Okay, example, replacing I'm helpless with I planned ahead and got help. I'm resourceful. 2, behavioral activation encourages meaningful daily activities to contract apathy and isolation. Activities are tailored to physical limitations and off time fluctuations. Anxiety and stress management. Techniques include breathing exercises, guided visualization, and progressive muscle relaxation. 4, sleep hygiene. Just a second, I'll be right with you. establishing routines to improve sleep quality, which is often disrupted by PD, self assessment, and goal setting. Patients reflect on what brings them joy and meaning and set achievable goals. Evidence, evidence and outcomes. Studies show significant improvements in depression and anxiety and quality of life, sustained even 6 months post treatment. One randomized controlled trial found that telephone based CBT led to a large effect sizes for depression reduction in PD. Participants reported feeling more empowered and less isolated with improved coping strategies. Delivery formats, phone based CBT, accessible for those without internet or video capabilities. Video based CBT allows for richer interaction and virtual cues. Mindfulness based cognitive therapy, or MBCT, combines CBT with mindfulness practices, also effective via online platforms. Broader implications. This model aligns beautifully with your interest in frailty aware, memory friendly care. It's scalable, adaptable, and deeply person centered. It, it also opens up doors for predictive behavioral algorithms and ambient assisted living systems to integrate mental health support seamlessly. Would you like to explore how MBCT compares to traditional CBT in Parkinson's, or how these therapies could be embedded into smart housing environments? I think we're on the edge of something transformative. That's a brilliant intersection. Blending cognitive behavioral therapy with smart housing environments opens up a world of possibilities for protective, personalized mental health support. Here are some compelling examples that align with your interest in memory friendly and frailty aware care. Ambient mood monitoring and feedback loops. Smart homes equipped with emotion sensing wearables or voice analysis tools can detect signs of distress or cognitive overload. These systems can prompt CBT based interventions like guided breathing, reframing exercises, or journaling prompts via voice assistance or mounted displays, cognitive reduction, cognitive restructuring via smart interfaces. Residents might uh, residents might receive daily thought challenges or positive reframing cues through smart mirrors or tablets. For example, a mirror might display what what's one thing you handled well yesterday, reinforcing CBT focus on self affectancy and cognitive reframing. Behavioral and activation scheduling, smart calendars integrated with CBT goals can nudge users to engage in meaningful activities, e.g., it's time for your walk. Remember how energized you felt last time. These systems can adapt based on mood, data, sleep patterns, and engagement history, sleep hygiene, and anxiety reduction. Smart lighting and temperature controls can be programmed to support CBT based sleep routines. If insomnia is detected, this system might offer CBTI, CBT for insomnia models like stimulus control relaxation exercises, tele CBT integration. Smart homes can facilitate secure scheduled CBT sessions via built-in video portals with reminders and pre-session mood check-ins. AI companions like me could offer an in between session support, reinforcing CBT techniques like tracking progress, mindfulness zones, and guided practice. Design areas in the home could activate CBT informed mindfulness routines when stress is detected. Think ambient soundscapes, guidance, breathing guides, or grounding exercises triggered by biometric feedback. Predictive behavioral algorithms. Over time, smart systems can learn platforms or patterns, e.g., withdrawal, aggression, and uh, initiate CBT based coping strategies before symptoms escalate. These algorithms could also alert caregivers or therapists when intervention thresholds are met. This kind of integration not only supports autonomy but emotional regulation, but also aligns beautifully with your vision for equitable, memory friendly environments. Would you like to explore how these systems could be ethically implemented or how they compare to traditional CBT delivery in clinical settings? Okay, hold on. Smart housing is becoming a dynamic platform for integrating a wide range of therapeutic uh, modalities beyond CBT. Here's a created list of approaches that are gaining uh, traction, especially in memory friendly and frailty aware environments. Mindfulness based therapies. Smart homes can trigger guided meditations or breathing exercises based on biometric stress indicators. Ambient lighting and soundscapes can shift automatically to support emotional regulation. Expressive art therapy. Expressive art therapy. Integrative walls or digital canvases allow residents to engage in virtual art creation. Okay. Music therapy models can be personalized and scheduled with adaptive playlists responding to mood or time of day. Somatic and movement therapies. Motion centers Motion sensors can guide gentle yoga, tai chi, or frank, filled, uh, filled desk routines tailored to mobility levels. Real-time feedback from wearables helps track progress and prevent injury. Okay, reminiscent and narrative therapies. Smart smart displays can cycle through personalized photo albums, voice recordings, or memory prompts. Okay, AI companions can facilitate storytelling sessions, reinforcing identity and cognitive engagement. Okay. Sensory integration therapy. Adjustable textures, lighting, and sound can be used to create calming or stimulating zones, particularly beneficial for individuals with autism, dementia, or sensory processing challenges. Psychoeducation and self-management. Smart interfaces can deliver bite-sized molecules on coping strategies, nutrition, and sleep hygiene. Residents can track their own progress and receive nudges aligned with therapeutic goals. Socially assistive robotics. Robots can engage users in therapeutic games, conversation, or physical activity. They also support emotional connection and reduce loneliness in isolated populations. These approaches can be layered into smart housing ecosystems to create adaptive, responsive, and deeply personalized therapeutic environments. Would you like to explore how these could be ethically implemented or how they might intersect with predictive behavioral algorithms and ambient assisted living systems? Okay, guys, I'm going to take a break for now. I'll be back on with a couple more tonight for you. For now, Gator Wellness, take care, folks.